Welcome to the Dental School Guide podcast, your ultimate destination for all things dentistry. I'm Dr. Tanner Townsend, your guide through the complex world of dental education. Join us as we uncover the secrets of acing dental school admissions, navigating residency programs, and exploring career opportunities. Please share and enjoy. Real quick, just wanted to make all you pre-dental students out there aware of a resource. If you've ever been worried about getting into dental school or are wanting to get into that school of your dreams, then you definitely want to check out a program called Dental School Guide. In the program, we walk you through how to save money, time, and heartache when applying to dental school. There's so much fluff out there when it comes to resources for getting into school, and we are streamlining all of that. With our comprehensive digital course, expert mentorship, and personalized application review services, you'll have everything you need to stand out to admission committees. Take advantage of this amazing resource that will help you increase your chances of getting into dental school. You'll want to check out dentalschoolguide.com. Check it out. Welcome back to another episode of the Dental School Guide podcast. I'm your host, Dr. Tanner Townsend, and today we have the admissions team at MUSC in South Carolina with us, Joe and Camille. Joe, Camille, we are super excited to have you both on the podcast with us today. Welcome.
Thanks for having us.
We are excited to have you both. Well, first and foremost, let's get to know you guys a little bit better and what your role currently is at MUSC. So, Camille, would you like to go first? Tell us a little bit more about yourself and who you are.
Sure thing. So I have been here at MUSC for about 2 years now. Before that, I was working as a special education teacher in middle and high school levels. I wanted to be able to work with students and help individuals achieve their goals. And so when I found this opportunity, I felt like it was a perfect segue. And I've enjoyed working here ever since. I enjoy getting a chance to help applicants possibly achieve their lifelong goal of becoming a dentist. And I have a great team to work with.
Thank you for coming on the show. And Joe, tell us a little bit about yourself.
So my name is Joe Vuthiganen, or the students call me Dr. V for short, just to truncate that a little bit. But I went to dental school here at MUSC and then did a residency at UNC Chapel Hill, and then decided I didn't want to leave the world of academia. So I came here and thought I'd teach for a couple of years and see how it goes. And I've been here ever since. I've just really enjoyed being in academics.
Well, it's a good spot to be, and MUSC is a wonderful school. So today we want to get to know a little bit more what is so special about MUSC and what makes it a great place to come to school to. And then we also want to talk about like the admissions side and what makes your guys' admissions process a little different than other schools and what you guys are looking for in applicants and what applicants kind of would fit best in the MUSC culture. So to start, we want to know just what makes your school unique. And what makes MUSC different than other dental schools potentially around the country? And we can kind of start really broad, and then we'll kind of narrow it down into specific things about MUSC from there. So, Joe, Dr. V, tell us first and foremost what you think are some unique things about MUSC, because you went there.
Oh, yeah. And feel free to call me Joe. No formalities. So the cliche answer is obviously the people, and I believe that the people we have here are very friendly, very supportive of the students. We're here for their success. So I don't want to mention that, but aside from that, in talking with students at various outreach events through the student panels and listening to what they've said, the things that come up are our special care dentistry clinic. We have a clinic that's where the students rotate through, where they treat patients with special healthcare needs. We also have an elective that's associated with that, so they enjoy that opportunity here. And then also digital dentistry as well. We actually start using digital technology in the first year, and when they get into the clinics, we also have a clinic where they can use CAD/CAM, doing single visit crowns, and also for digital design. And more recently, we set up an innovation lab with a gentleman. His name goes by Dr. Tom. But through that lab, we're hoping to give students more experience where they can work with Dr. Tom, who does more process things. They can take their patient cases, work with him to design what have you, dentures or crowns with him, and actually manufacture it in-house through milling and through 3D printing.
Wow, that's awesome.
And last and really needs, obviously, just like real estate, location. We're in Charleston, South Carolina, so I love the fact that we're 15, 20 minutes from the beach. I mean, it's nice and sunny. Well, on a podcast you can't tell, but right now it's nice and sunny outside. Actually, this is a good time because we're in between summer and fall, so it's not the blistering heat of the summer and not quite the cold. So it's uh, good place to be in terms of the beach.
Yeah, we took a trip, my family and I did, down to Charleston like 2 years ago now. And man, I love Charleston. It's such a cool town. Awesome place to be, lots of things to do, and the beach is a wonderful spot as well. So
And also lots of places to eat.
yeah.
We had interviews this morning, and a lot of our topic was talking about where do we like to eat in Charleston, and there's no shortage of options.
Yeah, I think there are some darn good options in Charleston to eat. There's also some really interesting history that you guys have, and I love, like, we took a tour of the city while we were there, and there was some really cool buildings that you guys and structures that you guys have there that are kind of unique to the area, which is neat. Well, tell us on your side, what do you feel like is unique about MUSC?
Well, I don't have a background in dentistry, so I can't give you the specifics of how awesome the program is. That's why we have Dr. B here. But from the student standpoint, when I hear from the students, they really enjoy the family atmosphere. They're Even though it's a competitive program to get into, once you're in it, it's not a dog eat dog competition. Everybody is willing to work with each other. There's always faculty members that are willing to help. And coming from education standpoint, that's always a benefit and something that any student should look for when considering potential schools.
Well, I think those are some really good points, and I think we're going to touch on a number of those things here as we go throughout the day. So, Joe, a little bit more. I think I'm going to dive in a little bit to that special care dentistry and digital dentistry, because those are some interests that a lot of applicants, as they're looking into schools, have. Let's first maybe start with the special needs dentistry that you guys provide. Tell us a little bit more about how that clinic is structured and what exposure students can expect if they come to MUSC in terms of special care dentistry.
So with that rotation, I don't know all the details, but they rotate through there. I don't remember how many times, but they work with Dr. Michelle Ziegler, who's the director of that clinic. The one time that I served as attending there, is basically working with patients, typically probably doing prophies in there, and maybe some restorative work under their supervision. But yeah, that's unfortunately I don't know all the details of that particular clinic, but it's a required rotation, and then a part of that, and she's actually working with me right now to kind of enhance it a little more, to add some more classes on, because a lot of it is, working with the patients, just getting them to come to the dentist and to and then getting them, going over hygiene and things like that. So she's working to add more courses related, more classes, to that, and then also adding an elective to there as well.
I think that's great. I think a lot of it, like you said, is not necessarily the dentistry, and it's learning how to do dentistry on special care patients, but it's also more the communication side of learning how to communicate and interact with those patients on a social level, which is an important part.
Oh, and before I forget, she does have an opportunity through that where they can go to the operating room to work with patients who would obviously need to be treated in that kind of setting as well.
Oh, wonderful. So you guys do that through the hospital there, or do you guys have okay, that's great. In terms of digital dentistry, Joe, what you had mentioned, students get experience early on, I'm assuming scanning, like scanning a prep or something like that. So tell us a little bit more about what you guys are aiming to achieve as a school, hopefully with digital dentistry and the future students that are potentially going to be coming to MUSC.
So I guess our goal is to graduate students who can do the traditional side of dentistry, but also do the digital, so they'll be prepared for wherever they may end up. I mean, would love to have everyone, we would like to switch to digital, but we can't expect every student to go into a practice that's going to have the equipment they need for. And plus, a lot of the stuff you have to do for digital is going to be the same whether you go like PVS or scanning. You still have to have good isolation and all that. So with that, particularly with the innovation lab, we're trying to teach them more about doing things more in-house, like milling dentures and crowns. But that literally just started like a couple months ago. So we're kind of starting that, and hopefully it'll kind of grow into more.
That is wonderful. I think that is definitely the future of dentistry. We do a lot of printing and milling in my office, and We don't send much to the lab anymore. We have a designer that we send stuff to, and then they send it back, and we're off to the races from there, which is really kind of nice. So, in terms of as like the program, like as a class, as they go from year 1 through year 4, what are some things that you guys do in order to make sure that they have the clinical experiences that they need? So in a sense, as we're focusing maybe more a little bit on the clinical side of it, during that 3rd and 4th year, what are they doing their 3rd and 4th year, and how much time are they in the clinic? And then what external rotations outside the school do they get to go on?
So third, fourth year, most of their time is actually in the clinic. So first, second years are obviously in our classrooms and simulation lab, but third and fourth year clinics are from 9 to 12, 1 to 4 every day, except for Tuesday mornings. So that time is reserved for classes where it needs to be a little longer. So most of their time is in the clinics. In terms of external rotations, we have 2 external sites. So we're located in downtown Charleston, but we're obviously trying to increase our reach to the Charleston community. So we opened an external site at in West Ashley at a local mall, Citadel Mall. So basically, the JCPenney was converted into an outreach, not just for dental, but also for rest of MUSC. And so we have a little small clinic on the 2nd floor, which is kind of nice because then the students rotate out there, particularly the D4s rotate through there. It gives them a experience within like a small practice because you now have the main doctor, there's a hygienist, 2 or 3 assistants, front desk, that sort of thing. And we just opened a month or 2 ago in Nexton, which is a little further out. It's basically the same idea, small practice led by 1 dentist and hygienist assistant.
Awesome.
And then they do rotations at some of our some other clinics. That basically like free clinics or patients who have limited income to receive not only dental care but also other health care as well.
That's great. So how many weeks during that 4th year are those students able to go out on rotation and do those outside the school?
I was gonna say it varies. So I don't know the exact number, but I know I would say maybe 3 to 4. I honestly don't know the exact number, but there's several rotations like that, and it may vary by the student, but I would say several weeks, but I'm not sure of an exact number. I don't want to give you misinformation.
No, that's totally good. That's totally good. I think just in general, those rotations are just such a great learning opportunity for those students because it's like you said, it's more of a private practice setting, and they're able to really hone their skills from there. So for students that are like either wanting to specialize or wanting to kind of further their education, what opportunities are there to learn about other specialties in your guys' program to kind of enhance their skills if that's something that they want to pursue?
So we actually have a lot of specialty residency programs, so they certainly have access to visit those programs like oral surgery, perio, endo, pediatric dentistry, ortho. So they can certainly go there. And they have rotations through those clinics. They rotate through oral surgery, not with their assigned patients, but they'll go in and do extractions. And pediatric dentistry, they'll go in and do recalls or operative. And ortho, it's more of an observation clinic. And then endo, they have rotations through there where they'll see patients. But also, if their patients within their patient pools needs root canal therapy, then they would see them in there as well. So that's the first thing. The second is if we have electives as well. So if they were specifically interested in a particular specialty, they can take an elective in perio, pediatric dentistry, orthodontics, endo. So they probably already said that, but yeah, there's a couple one where they can kind of go into those. And there's not an elective, but it's my understanding that there's an oral surgery interest group. So for those who are interested in that, they could join that as well. And then last and certainly not least, if they're interested in a specialty, they can just go to the faculty in that area and say, hey, I want to know more, and can I come and observe more? And then they'll be happy to accommodate.
That's great. Now, when a student goes into that area where they're trying to either specialize or they're going to graduate and either do an HD or GPR or just go straight into private practice, how do you guys help students as they're transitioning, whether either to a residency program or private practice? Do you guys have anything that you guys specifically try to do to help students either find a job or find a residency program? I know a lot of it's on the student, but is there anything that you guys do to help assist those students in that way?
So this actually question came up during the interviews today. So I wrote down their answers because I wasn't 100% certain because I knew the electives we had and having the specialties and they can talk to it. They mentioned that some of them have gone to other faculty members and taken like their contracts and helped them review that as they're kind of looking at associateships. The dean of the school actually does interviews with them if they need a letter of recommendation from him, so that kind of helps them with that area. And then a lot of the student groups will have people come in for talks to talk about like DSOs or other private practice opportunities. I know some of the dental companies will come in and talk to students about opportunities there as well. In terms of other things, though, particularly for private practice, because we get this question a lot, we do have two practice management courses in the end of the D3, D4 year. So they come in and talk about, setting a practice, marketing, how not to get sued, those sorts of things. So there's that. Trying to think what else. And then hopefully those experiences at the West Ashley external site and Nexton external site, there's the opportunity to kind of see a private practice, and through there, hopefully talking with the dentists and the hygienists there about what they do there and what's it like to be in a private practice.
That's great. That's excellent. What do you guys feel like is how like the faculty student relationship is at your guys' school? Every school has like a little bit of a different dynamic and different ratios for faculty to students. And that's an important thing for a student and a pre-dental student deciding where they want to go. How do you guys feel like that relationship is at your guys' school?
I've been talking a lot. Do you want to answer? I'll answer.
Camille, I know dental is not your background, but feel free to chime in when we're getting to your admissions questions here shortly. So just whenever you want to chime in, go for it.
From what I hear, I think it's very open and welcoming. The faculty are able to talk to the students and kind of guide them through any issues that come up during the semester. The STEM lab is open for 24 hours, so students are able to go after hours. They will go in groups together to study and practice different things. So far, from what I've heard, it's a small, tight-knit community.
And you would add to that?
And I would agree. I mean, that's basically what I wanted to say, but I felt like I was talking a lot, so I wanted to give Miss Buckner a chance to talk. But yeah, I think that's one of the things we excel at is being there for our students. The gentleman next to me is Dr. Lowe. He gets here early, and I often see students have come and talked to him about their cases. And one thing we do is the students are assigned, when they get to the third and fourth year, they're assigned a preceptor, meaning one of us faculty members. And so when it comes time for treatment planning, they're supposed to meet with us to go over the case. And that's kind of our opportunity to talk to them and help them throughout the third and fourth year. There's that. And then also this is not related to the question, but just FYI, the students are also paired up, like they're D1 with a D3.
Mm-hmm.
So that way, during the first year when they're in the clinics, they observe them with assisting. And when they get to the third year, the other person now is graduating. So they'll take on that person's patients. So in terms of like mentorship, they have that faculty preceptor, but they also have that student who is 2 years ahead of them to kind of help them initially.
Very cool. So in that preceptor-student relationship, how many students per preceptor are there typically that you guys
Usually
take on?
9 to 10.
9 to 10?
Yeah.
Okay, that's great. And then are those preceptors the same ones? Like, how do you guys structure your clinic? Is it like a group practice, or is it like you're only with your preceptor, or does it rotate the preceptors and things like that?
Oh, so the preceptor is more just for treatment planning. So it's kind of done outside of clinics. The clinics are set up more discipline-based. So if you are doing operative, you're going to go to the operative fixed clinic because that's kind of grouped together. If you're doing dentures, you're going to go to the removable clinic. If you're doing implant, you're going to the implant clinic. So they don't necessarily stay with the preceptor when they're treating their patients.
Okay. And do you guys
go
for it. Sorry, I cut you off, Joe.
Oh no, I was just gonna say, but at least they're working with faculty who kind of specialize in the respective areas. So like in removable, we have the person in there. One of them is the person who teaches the removable courses. In implant, we have the prosthodontist and the people who teach the implant courses, and same for operative.
That's great. And do you guys let your students place implants or just restore them?
Just restore them.
Just restore them. Okay, that's great. Well, is there anything that you guys feel like you guys are working on as a school? And Camille, this question's for both of you here. Like anything that you guys are working on as a school to like improve experience for future students and like improve the school that you guys have coming down the pipes in the next little while?
So in terms of the digital dentistry realm, I think the innovation lab is the first step in that's trying to incorporate that more. Um, Personally, I would like to see it get incorporated more like in the preclinical courses as well. I know we are working towards adding more like CAD/CAM experiences within the required curriculum. Actually, just this past year, we had a CAD/CAM course that was an elective, and now it's part of the required curriculum.
Oh wow.
And what else? And
That
then yeah,
yeah, go for it, Joe. Sorry, I keep cutting you off.
no, that I was just music and no, but that's all I have for now.
Anything you'd
But that's
like to
all.
add to that?
I would just agree with what Dr. V said as far as the innovative technologies. As far as the admissions office, we're working on getting a new student information system and kind of supporting things in the back end where students won't really get a chance to see, but making it easier to apply in the sense of changing up the portal and the website and things like that.
Okay, that's great. Well, let's kind of move in to some of those admissions questions, which is like your neck of the woods more, Camille. So first, let's kind of start really broad and take us behind the curtain, if you don't mind, in a sense of what kind of happens as we go through the admissions process. So walk us through like just that first, like, let's say it's like May, early June. June comes, you guys are starting to get applications that are rolling in. How does that a first initial review process with like those applications go for you guys at MUSC?
Yeah, so once applicants complete their AdFast application as well as our MUSC supplemental application that always opens on or near July 1st, I am able to download the application information into our system. I verify that they have all of their materials, including their transcripts, letters of recommendation, test scores, things of that nature. And then I mark them as complete and send them a confirmation email. I then send those weekly completed applicants to the admissions committee for them to review. And then starting in about August, September is when we start the interview process. And every 2 weeks from September until February, we are interviewing about 20 candidates. Well, the committee is interviewing the candidates, getting to know them, and then they vote on them, send me that information, they calculate. They have weekly committee meetings where they discuss the applicants and those that interviewed, their credentials, their personality, things that you can't really see on paper. And then they make their decisions from there.
Okay, that sounds like a great process. We're going to kind of dive in a little bit deeper into some of the different things with that application process, if that's okay.
Mhm.
So, first, how many applicants do you guys typically get in a year? How many do you interview? And then how many do you guys typically accept on a yearly basis?
Yeah, so we receive about 1,400 applicants or applications every year. That number has been growing every cycle that I've been involved with. We have actually met the number of applications that we finished with already last cycle at this point today. So we
Oh
are
wow.
continuously growing. Yeah. Um, and so out of those 1,400 applicants, we interview about 200 of those, about 100 out of state, 100 in state. For a class of 78, about 52 to 53 of those will be in state. Um, South Carolina, as you know, we are the only dental school in South Carolina, so we have to give preference towards our South Carolinians. And then the rest, about 21 to 22 seats, are out of state.
Now, different schools have different opinions on this as we've talked with other schools and their approach towards how they view an application. And the consensus is like, hey, we look at the whole application in a sense because we want to know the whole person. But there are, at some schools, different cutoffs that are requirements that students have to meet in order to even be fully considered. So do you guys have certain GPA cutoffs or DAT cutoffs that kind of move an applicant from that initial review to the next round in a sense?
Yeah, so we have some broad kind of cutoffs. Whereas in-state applicants, we're looking for at least a 16 on the academic average in the PAT portion of the DAT and at least a 2.8 GPA. However, if they have a little higher of a GPA, things can be reviewed if they have a higher than a 3.4 or if they have a higher than a 18 average, then their GPA may be a little bit lower, just to give the committee a chance to view the applicant holistically and not necessarily specifically tied to those specific um, numbers, the GPA and the DAT. For out-of-state applicants, it's a little bit higher, 18 at least on the DAT for the AA and the PAT portions, and a little bit higher than a 3.5 is what they're looking for. But again, it's not um, super duper strict, I'd say. The committee is very understanding and really tries to look at the whole application, the whole applicant when determining who should be accepted.
That's wonderful. Now, I've had some students that we've spoken with ask this question. It's like, well, like I got an 18, but then I had like a 15 on one section, or I got like a 14 on one section. Am I going to get like removed from like these schools' lists? How does MUSC handle a situation like that where you've got a student that's done relatively well overall, but there's like a score or two either on the DAT or there's a grade or two in the GPA that is not quite what we hope it would be? How do you guys end up handling that from an admissions perspective?
Yeah, so um, we always try to look for improvement first and foremost.
Hmm.
Like I said, the committee is understanding. So as far as grades, if an applicant is worried that, they didn't do so well their freshman or sophomore year, it's understandable. What's more important is, do we see an upward trend? Did they figure it out sophomore year and have been excelling since? Same with the DAT, we see people retake them. Are we seeing an improvement on that? I think that because our process is so long from September to February, I always recommend that applicants send me updates if they retake anything, if they raise their GPA, and there is no pile. Is how I refer to it. There is this person will never get in and will never look at their application again. I am weekly sending updates to the committee and they're weekly reviewing the applications I send them. So as long as you can improve, hopefully it can improve your chances. There are no, um, I have applied and I know for a fact I'll never get in just based on these scores type situation.
Cool. So this is more of a question now for both of you, Joe and Camille.
Mhm.
As we kind of talk about like the interview process at MUSC, you guys just did it today, it sounds like.
We did.
Walk us through, like, if you're a pre-dental student coming to MUSC for an interview, what they can expect on the day, what's the day going to look like, and then how is your interview set up? Is it a one-on-one? Is it a good cop, bad cop, two-on-one? Is it a group? Those kind of things. So walk us through, both of you. Camille, let's start with you, and then we'll kick it over to Joe. But tell us what that day is like from an applicant perspective.
Yeah, so right now, our interviews are taking place virtually. They started during the pandemic doing them virtually, and it's just been very helpful for those out-of-state applicants that can't necessarily travel to get here. Um, we do offer for anybody that is interviewing a chance to come on campus for an in-person tour, so that they can still get that in-person feel and be able to see the campus in person if they would like. It's optional. The day starts with an introduction. I introduce myself, a couple of other members of the committee introduces themselves. Dr. V gives a wonderful introduction to our campus and the program in itself. And then applicants are split apart and they have two one-on-one interviews with faculty members. It is not an interrogation, it's definitely a conversation. I try to tell everyone that to try to calm their nerves. The faculty members are genuinely just trying to get to know the applicant as far as how they will fit, what are their motivations to becoming a dentist, and how well they'll enjoy the program. And then around noon, they come back together as a group for a more detailed campus tour and a student panel. Sometimes it's easier for applicants to be able to speak to students. They can ask all those nitty-gritty questions that they might not want to ask a faculty member.
That's great. Joe, anything to add to that?
Um, that's pretty much. I would say as one of the interviewers, we definitely our goal is to not interrogate or ask like intimidating questions. For me personally, I just want to get to know the person and what is their motivation to go into dentistry and why do they want to do it at MUSC. And then also while I'm interviewing them, I'm kind of saying, do I see this as a person that a patient would trust to provide dental care as well? So I like the fact that we do it that way. So it's more of a get to know you kind of thing.
Yeah. So from the sounds of it, it sounds like you guys are more of an open file interview, meaning like you've reviewed the file, Joe, before you interview the student typically, or is it closed file?
It's up to the interview, but a lot of us don't really look deeply into the file. Generally, all I know when I interview students is their name, their state, and their GPA and DATs. And I don't really want to look at anything else because I don't want to have any particular bias going in. And I want them to kind of fill in the gap. So I do warn them, hey, I'm going to probably ask you something that's on your application, but I just want to hear it directly from you, or I want you to emphasize what on our application really is more important to you, and also tell us what we wouldn't be able to get from your application.
Mm-hmm.
And getting back to something earlier, like if a student had like that one bad grade or something like that, that's the time for them to tell us that because we've all had that. I mean, I had adjustment going into college, so I didn't do so great my second year, and then I started to get the trajectory up some. So that's those are things that we kind of want to learn so we can not just go based on the paper and be like, oh, well, this person has a low GPA because there might be more story behind that other than they just had a bad grade.
Yeah. No, I think that's a great approach because a lot of times, like you said, we don't know the backstory behind a lot of those things. So as you're interviewing, Joe, take us behind like what a faculty member that interviews at MUSC is looking for in an applicant. What are some of those key things that you would say, hey, we're looking for this, we were looking for, like you had already kind of mentioned, social skills. Can I trust them with a patient? But what are some of those key things that you are typically writing down after you have an interview that you're like, okay, these are the key things about this person that we need to take to the table when we're selecting students for the next class?
I know it's not possible completely, but I'm really just focusing on their motivation. Like, why do they want to be dentists? And I know you can't really judge ethics, but I'm kind of
trying to
gauging
yeah.
that. And trying to just to kind of get an idea because we want culturally sensitive, ethical providers when all is said and done.
Yeah, that's fair.
So that's kind of what I'm looking at, just seeing how they converse, and some of the questions I'm trying to figure out, like what is their end goal, but also about why and why dentistry, because a lot of people will say, I just want to help people, but I'm like, well, why do you want to do it through dentistry? Because there's many ways you can help people,
Mm-hmm.
and many ways you can help in healthcare. So why dentistry specifically?
So on that question, let's kind of dive into that question because that's a common question that we get across schools in general. How would you caution pre-dental students to think about that question differently? And I know you had just mentioned like, hey, there's a lot of different ways to help people, but what would you advise students on how to approach that question if they get that question in an interview?
I would say be yourself because you have your specific answer, but just making sure that it doesn't sound like some scripted,
Mm-hmm.
I want to save the world one tooth at a time kind of answer. I had my dental Play-Doh kit when I was a kid, and so ever since then I've been turning. I mean, probably we're going to need a little more than that.
That's fair. I would agree that that's probably a little bit further on than the Play-Doh would be a good thing. How do you guys view like shadowing and volunteering? Some schools that we've spoken to in the past, they're like, okay, honestly, like volunteering is like right up there with the DAT and GPA in terms of importance. And others are like, yeah, we just kind of view everything holistically, and shadowing is important, but we also understand everyone has a different experience shadowing and what they get out of it. So for both of you, I mean, Camille, we can start with you on this one. How do you guys view specifically the shadowing and the volunteering experiences that an applicant comes to the table with?
Yeah, so we value that experience. I always recommend at least 100 hours of shadowing or dental or volunteer experience, especially if you are a traditional undergrad student applying in your senior year. But we do view applicants holistically. And so if they're, let's say, the captain of the football squad, or they're having to work through college, the committee understands that you might not have as many volunteer and shadow hours as someone that might not have to do those things or have those responsibilities. So I think there is no set, we need this. This is what we're looking for specifically.
That's very fair. Joe, anything to add with that?
Yeah, I would add, we were kind of looking to see what are they doing to move towards a career in dentistry, but we were very sensitive to the fact that there are other things going on. I just remember specifically one applicant, they were in a situation where they had to help bring money home to live, and so they don't have much time to go shadow, and so we're sensitive to that. But you could do other things. You could maybe do CE online, or I actually lately I've been recommending people going to YouTube and going to like Mental Dental, because they have a lot of good intro videos, which is good for starting to begin to learn the dental vocabulary. And then if they, as far as they can keep going on, because they cover a lot within that with that channel. But yeah, I think we just look at the whole package and see what they're doing to expose themselves and get them ready for the career of dentistry, whether it be through shadowing, through their leadership, or through their volunteering.
They're great things. Now, how do you guys view, let's kind of get into some, like we talked about, like the traditional applicant a lot that's going through the application cycle either as taking a gap year or their senior year. How do you guys view the students that either do post-bacs and master's programs, and do you guys have a preference on whether they do a post-bac or a master's program? Because some schools do.
I wouldn't say we have a preference as far as post-bac or masters. My biggest recommendation for especially non-traditional applicants that may have been out of school for a while or may have a lower than average GPA, I always recommend a post-bac program, just so that you can show the committee how well you would be able to handle yourself in a graduate level courses. But correct me if I'm wrong, Dr. B, I don't think that there's an actual preference for a specific type of program.
Yeah, there's no preference. But sometimes if a student maybe didn't perform as well, and I'll say for myself included, so I left undergrad with a not so great GPA, and so I was advised to go to the College of Charleston down the road, take gross anatomy, and did well in it, and that kind of showed the committee that that I could handle it. And more lately, we at MUSC we have a master's program that some people will take. It's a was it master's? It's a medical sciences master's, and actually that course is for med and dental. They take actually some courses with our dental students, so it kind of gives them a way to prepare for dental school, but also gives them something on the application to kind of show that they're doing additional work. And since they're taking some courses that are very similar to our dental courses, it gives an idea of how they would perform within the dental school.
Do you guys give preferences to like save a couple seats every year for some of those students that have gone through that master's program, or in a sense like guarantee an interview if they get a certain GPA in that master's program? How do you guys approach those students if they're applying to MUSC the following cycle?
I don't think we do. I don't think we save spots.
No, we don't save spots, but it is noted and it is discussed, especially if they make it to the interview process.
Okay. And kind of a similar question along saving seats. Like, for example, certain schools will have deals with the state in terms of making sure that they replenish, like rural Virginia, for example. Like, we want to make sure we have a certain number of applicants that are coming for rural Virginia, so they reserve a couple seats for students from rural Virginia. How do you guys handle rural candidates from South Carolina? Are there specific programs that you guys have implemented in the application cycle to make sure that you have certain population of your students that are from those rural areas in South Carolina, or is it nope, we just take everyone from South Carolina that feels is a good fit?
I think it's more of that option.
Okay, sounds good. That is awesome. All right. Well, let's as we get to the back end of, we've talked about the school, we've talked about the application and interview process. Tell us a little bit from both of your guys' perspectives, a little bit about advice. As a pre-dental student, let's say we've got a pre-dental student that is looking to come to MUSC. What is some advice or final pieces of advice that you both, Camille and Joe, would give that student to really focus on for MUSC? Camille, feel free to go for it.
Yeah, so I would, one of my biggest pieces of advice is to apply early with receiving over 1,400 applicants. Um, Make sure that you are in as quick as you can be, so that way you can increase your chances of getting selected for an interview. Um, and to make sure that you are putting your best self on your application. You're including all of your hours, whether it's a dental volunteer service or whether you volunteered with Big Brother, Big Sister. Even if it's not dental related, put it on there. Show yourself as an applicant, show your leadership abilities, what you're capable of, because we really are truly looking at the entire applicant. We're not just looking at the scores. We're not just looking at the letters of recommendation or your essay. All of it matters. And so just let your personality speak through it.
I second all of that. I guess to add to that, I would say obviously do some research about our school, and just kind of, and then because sometimes if they ask us something, we're like,
It's on the
why,
website.
why? Yes, on the well, I wouldn't, no, I wouldn't be like that, but it's like they ask us something, it's like if you just looked a little harder, you would realize that A, we have that or we don't have that, that sort of thing. But a question I do get a lot is like, so in terms of our prereqs, we require some science electives, and we get asked like, what should I take? And I usually advise to take courses that will prepare you for whatever dental school you may go to. But in particular, what comes to mind are classes like gross anatomy, microbiology, biochemistry, if you aren't already taking it as part of your degree, because I think having that under your belt can help you be a little further ahead once you get into school, because you already have that vocabulary or that knowledge. Because for me personally, because I took gross anatomy that one time to prepare to, in addition, that helped me for that class, but I didn't take microbiology in college. So when I got to that class, that was more of a, drinking from the fire hydrant kind of thing, because it was just all literally foreign, foreign words to me initially. Um, but that'd be my advice in that part, in addition to what Miss Camilla said.
Awesome. Well, you guys have been awesome to have on the podcast. Thank you so much once again, Joe and Camille, for joining us today. And we've really enjoyed having you on the show and sharing the wonderful things that MUSC has to offer. So that is it for today's episode of the Dental School Guide podcast. And we will talk to you all later. That's all for today's episode of the Dental School Guide podcast. We hope you've gained valuable insights and inspiration to fuel your journey into dentistry. Don't forget to subscribe to our podcast for more expert advice, inside tips, and engaging discussions. If you enjoyed today's episode, please leave us a review. It would mean the world to us. Until next time, keep smiling, keep striving, and remember, your dental dreams are closer than you think. Thanks for tuning in to the Dental School Guide podcast.